Hey everybody, it's Kelly from Physical Therapy U. I wanted to do another quick video today. This one was per request. We're going to talk about iliotibial band syndrome, or ITBS, also known as runner's knee. So what is IT band syndrome? It is an overuse injury that results in usually lateral knee pain or pain on the outside of the knee. So what causes it? A few different things can cause it. Usually it's, like I said, overuse. If you're starting a new running or biking program, that will kick up some inflammation and some pain there. Another thing that can cause IT band syndrome would be what we call pronation of your feet. So if your feet kind of roll inward, that's called pronation, and that can cause an increased force kind of on the outside of the leg here, on that IT band, causing pain at the knee. And then the other thing that causes it is weak hip muscles. So if your hip muscles aren't really supporting the lower leg, as you run, your knee is going to take a little bit harder of a hit, and more force is going to go through there and cause a little inflammation and a little pain on the outside of the knee. So those are the three main things that cause it: weakness in the hips, overuse activities, and also pronated feet. So sometimes your feet can be pronated because of ankle weakness, and sometimes just anatomically that's the way your feet fall. And those are things that a physical therapist could actually take a look at and say, hey, you know, you're tight here, you're weak here, and you need a little support here, or any combination of those things. So that's why it's important that you don't just start an exercise program and Google something, because all those things have very specific factors to them that a physical therapist can assess. So that's what IT band syndrome is. Those are the things that cause it. I just want to give you a little visual on what exactly the IT band itself is. So it's called the iliotibial band. It's a thickened band of connective tissue. It's actually fascia that runs along the outside of the leg, and it runs from your ilium all the way down to below your knee and inserts on the tibia, hence iliotibial band. So it runs that entire length. And it's, like I said, it's just a thickened portion of fascia. So fascia surrounds all of our muscles, all of our organs throughout the body. And so there's one fascia, tensor fascia, that goes around the entire leg here, and then there's a really thickened portion of it along the outside of the leg, and we call that the iliotibial band, although that fascia, like I said, does surround the entire leg. So if you want to get a nice visual of what fascia is, if you think of a chicken breast, and when it has that white, like filmy surface to it and you can kind of peel it away, that's fascia. Sometimes that fascia is laid down, is a little more stuck to that chicken, and sometimes it's like slippery and can go smoothly right over it. So that's what fascia is. When the fascia is really tight, when the IT band is tight, it's really laid down there. So here's another visual of it, right? So here's our anatomy, got kind of a glare on there, skeleton. So if you look over here, trying to do this with the reverse camera, there's a thickened white film. That is your IT band, and then kind of where it starts, and then it's going to go along the outside of the leg. And it was cut away at one point, and then you see it out here again, and then going to below the leg. So that is the IT band, if you want a nice visual of it. So what are some things that can make IT band syndrome better? Well, if you're pronating at the feet, like we said, your ankles are rolling in, you can either do some strengthening there to support it if you are indeed weak, or maybe you need some sort of insole to help support your foot so that you don't roll in. If you're tight, we have a bunch of stretches that we can do for those tight muscles. And if you're weak, we would obviously do a bunch of strengthening. And a lot of times what we find is that there's weak external rotators of your hip as well as weakened abdominals. So we do a lot of abdominal strengthening, a lot of hip strengthening there. One of the questions we get all the time, because we call it IT band stretching, can you actually stretch your IT band? No, not really. They've done research on it. You're really not going to put a change in the length of that tissue. It's connective tissue. It's really, really thick. It's really, really strong. When you're doing IT band stretches or rolling out your IT band, you're actually maybe loosening up the muscles more than you are the actual band. So that's what the stretching does. And then one of the other things that can help with IT band syndrome is sort of the hands-on soft tissue work, instrument-assisted manual therapy, like, you know, when you see people using Graston and techniques like that, the cupping, and as well as foam rolling. So there are two different kind of effects that happen when you're doing the hands-on instrument-assisted or foam rolling, right? You have the actual neuromuscular like effect to it, which is a reduction in muscle tone and tension around the area, and then you have more of like a structural or effect to it, where you're bringing increased blood flow to the area, and that's the point of like cupping and things like that, is bringing blood flow. So you're bringing nutrients to the area to help with the healing process. So that's what IT band syndrome is. That's where the IT band anatomically is and what it looks like and the density of it. We went over stretches, exercises, and maybe a little actual support in your shoes if that's part of the issue to treat it. Ice, obviously, I missed that one, but that's like a huge one too. It's inflammation, it's overuse, so you want to ice kind of closer to the knee area or along the outside of the leg, 10 to 15 minutes. Those are things that can help it as well. So that's IT band syndrome. I hope I didn't get too detailed. I hope that makes sense. Please ask any questions, because I love questions, and if you want more details, I would love to give a million more. So thanks for tuning in. Thanks for listening. I know this was a long one. All right, have a good weekend, everybody.